Masturbation is a natural and normal part of human sexuality. In fact, medical experts note that masturbation is a normal, healthy part of your sexual development, with many physical and mental benefits. For most men, including those who masturbate daily, masturbation does not have serious negative effects on prostate health or sexual function. On the contrary, sexual health experts and studies find that frequent ejaculation can be linked to prostate wellness and is generally safe. In this report, we review current research and expert opinion to explain how daily masturbation can affect the prostate and sexual function, highlighting both possible benefits like reduced cancer risk and stress relief, and drawbacks such as temporary sensitivity changes or compulsive use. We also offer practical guidance on healthy sexual routines and when to seek medical advice. Prostate health and ejaculation. The prostate is a small gland that produces fluid in semen. Researchers have long wondered whether ejaculation frequency influences prostate health. On balance, the evidence suggests frequent ejaculation is associated with lower prostate cancer risk, though the exact mechanisms are not fully understood. For example, a large Harvard study found that men who ejaculated 21 or more times per month had about a 31% lower chance of being diagnosed with prostate cancer than those ejaculating only 7 times a month. An Australian study similarly found that averaging about 5 to 7 ejaculations per week was associated with a roughly 36% reduction in prostate cancer before age 70. In plain terms, the more often men ejaculate through sex or masturbation, the lower their long-term prostate cancer risk appears to be, possibly because regular ejaculation may prevent the buildup of cancer-causing agents in the prostate. A respected Australian urologist explains there is plenty of evidence to suggest that masturbation might be good for your prostate, as long as one avoids risky behavior, like sexually transmitted infections. It's important to note that while frequent ejaculation seems protective against prostate cancer, no specific magic number of ejaculations is officially recommended. Urologists emphasize that men should focus on what feels comfortable and healthy for them rather than aiming for a set frequency. In other words, daily masturbation is not inherently too frequent if it suits the individual. One source casually notes that masturbating many times a day isn't harmful if your life is otherwise healthy. The key factor is that sexual activity is safe and balanced. In fact, some evidence suggests that men who do not ejaculate for very long periods may not harm themselves, but gaining the potential protective benefit simply requires regular release over the years. Regarding other prostate issues, like benign prostatic hyperplasia, BPH, the data are less clear. Some older studies suggested men who ejaculate at least weekly had slightly fewer urinary symptoms, but after accounting for age, that association disappeared. In practical terms, ejaculating daily or frequently has not been shown to worsen prostatitis or BPH and is not known to cause prostate enlargement. However, if you experience urinary pain, difficulty urinating, blood and semen or urine, or persistent pelvic pain, you should consult a doctor. These symptoms can indicate infections or other prostate conditions unrelated to masturbation. Impacts on sexual function. When it comes to erections and orgasm, medical research is reassuring. Masturbating itself does not cause erectile dysfunction, ED, or reduced libido. Multiple sources agree that masturbation is natural and does not harm erectile quality. For example, an overview by Medical News Today states flatly, masturbation is natural and does not affect the quality or frequency of erections, and that masturbation cannot cause erectile dysfunction. The Cleveland Clinic echoes this, listing that myths such as masturbation causes erectile dysfunction or low libido have been thoroughly debunked. In fact, orgasm causes a feel-good hormonal release, dopamine and oxytocin, that can improve mood and reduce stress, potentially benefiting overall sexual health. Nonetheless, how you masturbate can influence partner sex performance in some cases. A well-known phenomenon called death grip syndrome refers to desensitization from very tight or very fast masturbation. Health experts warn that if a man always masturbates with an extremely firm grip or under very high stimulation, for instance, always watching intense pornography at the same time, his penis nerves can become temporarily numbed. Over time, he may need more intense stimulation to reach orgasm and may find it harder to climax with normal intercourse. This is not an inherent effect of masturbation itself, but rather the manner of stimulation. The good news is it is usually reversible. Taking short breaks, switching techniques, or using lubrication can restore sensitivity. Current studies confirm that frequent masturbation alone is a weak factor in ED. A large 2022 study of over 3,500 men found that masturbation frequency had only weak or no consistent association with erectile function or dysfunction once medical and emotional factors were considered. In other words, known risks like age, cardiovascular health, diabetes, stress, anxiety, and relationship problems are far more important in ED than masturbating daily. However, that study did note that the combination of heavy pornography use with very high masturbation frequency could contribute to performance anxiety or satisfaction issues. In some men, daily masturbation can temporarily shorten libido or increase the refractory period in the short term. For example, after an orgasm, there is a normal refractory period during which you cannot immediately achieve another erection. If you masturbate to climax late one night, you may not feel fully able to have sex or another orgasm the next morning. But this is a normal physiological recovery, not a sign of damage. With regular sexual activity, masturbation or sex, some men report that over time the body adjusts by shortening the refractory period. In any case, unless you have an underlying health issue, masturbating daily is unlikely to cause lasting erectile problems or loss of libido. If you do notice persisting erectile difficulties during sex, not just right after a big solo session, it is wise to consider other causes, health, hormones, stress, and consult a doctor if needed. Potential benefits: masturbation can have several positive effects for sexual health and overall well-being. Stress relief and mood lift. During orgasm, your brain releases hormones like dopamine and oxytocin, which promote pleasure and relaxation and counteract stress. Many people find that masturbation helps them unwind, sleep better, and improve focus. Cleveland Clinic lists reduce stress, improve sleep, boost mood and focus among proven benefits of masturbation. Prostate flush hypothesis. Some experts believe regular ejaculation may flush out harmful substances from the prostate. This could explain the link between frequent ejaculation and lower cancer risk. At a minimum, ejaculating regularly keeps the prostate fluid moving. Sexual self-knowledge and practice. Masturbation is often called practice for partnered sex. It helps you learn what feels pleasurable, improves your knowledge of your own body, and can make you more confident in sexual situations. Healthy male masturbation, in moderation, has even been linked to an enhanced sex life and satisfaction, safe sexual activity. Masturbation carries no risk of pregnancy and very low risk of sexually transmitted infections, STIs, when done with proper hygiene. Cleveland Clinic notes, it's rare to get an STI through masturbation, especially if you clean your hands and any sex toys. In older men, masturbation may help relieve minor symptoms like urinary urgency or prostate discomfort, though evidence is mostly anecdotal. Potential drawbacks and risks. While generally healthy, daily masturbation does have some possible drawbacks, especially if it becomes excessive or done aggressively. Temporary desensitization. Masturbating too often or too aggressively can reduce penile sensitivity. For example, if someone always squeezes very hard or uses one technique, he may eventually find other types of stimulation, like intercourse or a gentler touch, less arousing. This can lead to delayed ejaculation or difficulty climaxing in partner sex. However, this effect tends to be reversible by adjusting habits. Experts recommend taking short breaks from frequent masturbation and varying technique or using lubrication to restore natural sensitivity, chafing, or physical irritation. Vigorous or very frequent masturbation can cause minor injuries, chafing, bruising, or slight swelling of the penis, or soreness of the genitals. These are generally minor and heal quickly. In Cleveland Clinic's review, they note that too roughly masturbating may cause tender skin or a temporarily swollen penis, but any irritation should heal within a day or two. The remedy is to use lubrication, be gentler, and allow brief rest days if needed. Psychological dependence or compulsiveness. A key risk is not physical, but behavioral. If masturbation becomes compulsive, meaning it takes up excessive time or is used as the primary coping mechanism, it can interfere with daily life, relationships, and self-esteem. Experts caution that while masturbation itself is healthy, for some people, the tendency to masturbate can grow excessive or compulsive to the point it feels out of control. Signs of a problem include masturbation taking up large amounts of time that might otherwise go to work, hobbies, or social activities. Choosing to masturbate at inappropriate times, e.g., missing meetings, doing it in public or after a party instead of staying socially engaged. Using masturbation as a primary way to cope with anxiety, stress, or negative emotions, to the point that negative feelings only go away through orgasm. Feeling guilty, ashamed, or distressed about your masturbation habits, yet being unable to stop or reduce them. Problems in your personal or romantic life, partner feeling neglected, for instance, because of how often you masturbate. If you notice these patterns, it's not because masturbation is bad, it's because anything done compulsively can cause issues. In such cases, health professionals recommend speaking with a doctor or therapist. Verywell and Healthline both suggest that if masturbation causes problems, therapy or counseling can help identify underlying causes like stress or depression and develop healthier habits. Impact on partnered sexual satisfaction. Some men who masturbate very frequently sometimes report less interest or satisfaction with partner sex. This can happen if someone becomes accustomed to a particular kind of stimulation and then finds partner sex less intense. For example, a study found that among men in relationships, higher masturbation frequency was associated with worse orgasmic function and lower sexual satisfaction. This does not mean masturbation causes poor sex. Rather, it may reflect that men who have trouble with partner sex sometimes use masturbation to compensate. Communication with partners and mixing types of stimulation, e.g., switching from masturbating to partner sex as climax approaches, can help. The key is balance. Masturbation should not replace intimate time with a partner unless both are comfortable with that choice. Healthy masturbation habits and precautions. To maintain a healthy sexual routine that supports prostate wellness and sexual function, consider the following guidance. Listen to your body. There's no universal right frequency. If daily masturbation feels good and causes no problems, it can be fine. But if you notice soreness, fatigue, or decreased arousal, you might give your body a little rest. For most men, masturbating a few times a week to once per day is within normal range. There's no medical need to push a specific number. Focus on what feels physically and mentally comfortable. Practice gentle technique. Use lubrication if needed, and avoid an overly tight grip or very aggressive motions. A gentler, varied approach prevents chafing and nerve desensitization. If you like using devices or toys, clean them thoroughly before and after use to prevent infection. Keep it private and appropriate. Masturbating in public or unsafe locations, like driving or showering, is risky and considered a compulsion sign. Make sure you do it in private, where you feel relaxed and unhurried. Hygiene and safety. Wash your hands and genitals before and after. Using a condom on a toy or finger, or cleaning the toy, can prevent any rare risk of infection. Never insert objects that could break or cause injury. Balance with social and partner life. Maintain a healthy balance between masturbation, partnered sex, and other activities. If you have a partner, communicate openly about sexual needs. It's generally beneficial for couples to share sexual activities. If one partner masturbates a lot, they might consider how it fits with their sexual relationship. Alternating masturbation with sex, for example, stopping before climax during masturbation and switching to partner sex, can sometimes improve mutual satisfaction. Mind your psychological health. If you feel guilt or shame about masturbation, often due to cultural or religious beliefs, remember that experts agree it's not immoral or harmful to masturbate. Talk to a counselor or a sex therapist if guilt persists. Likewise, if you find yourself using masturbation to escape from stress or emotional pain, consider more coping strategies. Exercise, hobbies, or mindfulness can help, as can therapy for anxiety or depression. When to seek help. Daily masturbation rarely requires medical intervention. However, you should consider seeing a doctor if you experience pain or injury. If masturbation causes significant discomfort, sharp pain, bruising, prolonged swelling beyond a couple days, or injury to the penis or genitals, it's wise to get it checked. Persistent pain during or after orgasm might indicate an underlying issue, such as a urinary tract infection, prostatitis, or a circulation problem. Sexual function changes persist. If you notice ongoing erectile difficulties that don't resolve with changes in masturbation habits, or if you have trouble ejaculating at all with a partner beyond the usual refractory period, consult a urologist. While daily masturbation alone should not cause ED or impotence, other factors might be at play. A medical evaluation can check testosterone levels, blood flow, or nerve function and rule out conditions like diabetes or high blood pressure. Symptoms of prostate problems. Regular masturbation does not cause serious prostate disease, but if you have urinary symptoms, frequent urges, weak flow, difficulty starting urination, blood in urine or semen, or discomfort in the pelvic area, see a doctor for evaluation. These could indicate BPH, prostatitis, or other conditions that require treatment. Mental health concerns. If you suspect your masturbation is compulsive, if you can't cut back despite wanting to, or it's causing marked distress in your life, don't hesitate to seek help. A mental health professional experienced in sexual behavior can provide guidance. Likewise, persistent feelings of anxiety, depression, or shame around sex are best addressed with professional support. Masturbation is a safe and healthy sexual activity for most men, even daily. On balance, regular ejaculation appears to have more benefits than risks for the prostate. Studies and experts agree that frequent orgasm is not harmful and may indeed help reduce prostate cancer risk. From the standpoint of sexual function, masturbating daily does not cause erectile dysfunction or long-term loss of sensitivity. Rather, any negative effects, like temporary numbness or compulsion, arise when masturbation is done very aggressively or replaces all other forms of intimacy. To keep your sexual routine healthy, pay attention to how you feel physically and mentally. Use lubrication, keep hygiene, and vary your routine so that your body stays responsive. Remember that there is no shame in masturbation. It can be part of a vibrant sex life and contribute to prostate wellness. As long as it doesn't interfere with your daily life or relationships, daily masturbation is generally considered a normal and even beneficial practice. If concerns arise, consult a healthcare provider for personalized advice. Sources: peer-reviewed studies and expert medical publications, Harvard Health, Cleveland Clinic, Healthline, etc., confirm that masturbation is largely safe and linked to prostate health benefits, while also outlining the few precautions to keep in mind. These sources provide the basis for understanding how daily masturbation relates to prostate wellness and sexual functions.